Hi, hello, namaste. Welcome back to our channel. My dear students, I am here to discuss today topic is introduction to community health nursing. So here, this is a very important subject for the nursing students. So that is nothing but community health nursing. So before going to discuss about the what is the community health nursing, let me tell what is the differentiation in between community health nursing and clinical nurse. There are the two kinds of the nurses there. The community health nurse is nothing but the nurse who is dealing about the public health, who is serving the health within the public, within the village, within the rural, within the urban, is nothing but is called as community health nurse. Whereas what is the meaning of a clinical nurse? Those nurse will be called as the clinical nurse within the hospital. So here, when the patient got the disease condition, when the patient is admitted in the hospital, when the nurse is giving treatment within the hospital, that nurse will be called as clinical nurse. So what is the here main differentiation? Before getting the disease condition, how you are treating, where you are treating, that is the responsibility of community health nursing. Prevention better than cure. So here, what is the meaning of clinical nurse? After getting disease condition, once the patient is admitted in the hospital, when she is treating and curing, that nurse will be called as clinical nurse or somebody. So this is the main differentiation in between community health nursing. That's what the community health nurse part, roles and responsibilities is the very important compared to this clinical nurse. Let us see what is the meaning of community health nursing and what are the characteristics we must maintain as a community health nursing. This is a very important topic for the exam point of view and as well as for knowledge also. Here you can see the community health nursing is a field nursing. Means, as I told you, she is going for home visit. She is serving and she is providing service at the doorstep, at the field level. In that case, the prevention is going to happen. She is giving such a kind of health educations. She is giving such a kind of the preventive measures. Such things will be helpful for the preventive level at the bottom. So that is the field. This is one of the characteristics, and she is serving the public health, as I told you, and mainly she is focusing on the three things, that is a promotion and prevention and wellness. So what she is promoting? She is promoting the health for all the individuals in the rural and urban, and she is going to prevent the illness. So whatever the disease conditions belongs to the patients, so which is getting non-communicable, communicable disease, health hazards, and getting problems because of population explosion, so such things will be she is going to prevent. And wellness, well-being, wellness centers are there nowadays we are observing. In that case, this is a main characteristics for the community health nurse. As well as we can see, she is promote the client responsibility and self-care and yoga and meditation, and we can collaborate the care for the patients. So these are the characteristics we can observe for the community health nursing. And next thing concept is roles and responsibility of community health nursing. So these are all the roles and responsibility of being a community health nurse. The first one is clinician. So she is must be focused on clinical part. So once the patient is coming for sub-center or PHC or CHC or UPHC, whatever the rural and urban centers are there, she must give the proper appropriate care to the patient, like wound care, like conducting of delivery. What are the minor procedures are there? What are the minor technical procedure, medical procedures also? She must provide. That is one of the roles and responsibility of the nurse. And next one is a educator. As I told you, within the rural level, within the urban level, the community health nurse must be act like a educator. She must give health education at any cost. She must give different kinds of the aspects are there. So there are the national programs are there. For each and every national program is belongs to one particular disease condition for the prevention, for the curable. She must give the proper appropriate health education. That must be called as educator. And next one is a advocate. Within the village level and within the urban level, there are the lot of different kinds of the patients are there. Each and different kind of the patient will talk differently. So you are the community health nurse, you must act like an advocate. You must listen what the patient is telling, what the client is talking with you, understand in the positive way and give the feedback in the positive way. That is the way is called as advocate. So collaboration, the communication, the positive way you must show within the community level. And next one is manager. So being the community level, being the community health nurse within the community, in the rural and urban, you must act like a manager. You must manage everything. You must act like a clinical part. You must manage every documentation part. You must act every national programs. Everything you must deal it. And next one is collaboration. Nothing but helpful for the patient, helpful for the clients. You must understand what is the critical situation. You must understand what is the logical situation, how the referral system you must go through it. That is the pay of attention is very important in the case of community health nursing. And next one is the leadership. So there is a lot of the patients and clients will come for your service every day. In such a case, you must act like a leader in order to give the proper care to the patient. And next one is the researcher. Researcher is very important because nowadays we are seeing vector-borne diseases, waterborne diseases, or insect diseases. So whatever the diseases coming from the rural, you must pay your complete attention what exactly cause. You know what is the main element within the community, point out and rectify, attract that cause. So once you are going to cut the cause of the disease condition, the 50% the treatment you are going to give. So that is called as this researcher. So these are the main roles and responsibilities for the community health nursing. And remaining the scope of community health nursing. If you are becoming as a community health nursing, what is your scopes? At the which level you are going to do job? There are the different kinds of the aspects are there. Mainly you are focusing these things. The first one is health promotion, health prevention and health restoration. So combining these three things, there are the different kinds of the scopes are there. The first one is nursing care. So within the hospital, like a HWs, PHC, sub center, UPSC, UHC. So the different kinds of the things you're going to eligible for doing job. That is one of the scope. And next scope is mental health nursing. There is a mental health psychiatric hospitals are there. Those who have disability with their mentality, those who are in the stress and anxiety and depression, you can able to treat them. That will be called as mental health nursing. And domiciliary nursing is nothing but you go for the doorstep, go for the home visit. So within the home there is a lot of the clients is uh, suffering with the problems. In such case, if you are treating with them within the home level, that will be called as domiciliary nursing. And next one is called as industrial nursing. So within the industry there is a lot of the problems they will get. That will be called as industrial hazards. We have industrial occupational hazards we have. So they are having some problem. If you're going and treating, that will be one of the scope, that is the industrial nursing. And next one is called as home care. So those who are need your care, being the community health nurse, you go and treat them. That will be called as one of the scope is home care. And next one is geriatric nursing. Those who are geriatric people, nothing but oldest peoples, about the 60 years, about the second 70 years, those who are unable to walk, those who are doing themselves work, you just treat them. That is one of the scope is nothing but geriatric care. And next one is MCH or family welfare. MCH is nothing but mother and child health. Antenatal, internatal, postnatal, neonatal is complete together is called as MCH service or RCH service, reproductive child health. So this is the very important aspect. Being the community health nurse, you must focus on this service. So this is one of the scope. And next very important, school health nursing. So within the school there is a lot of the kinds problems, minor problems we can observe. Teeth problem, skin problem, hair problem, or this kind of the infection problem we can observe in the school setup. In such case, if you are doing here the services, that will be called as school health nurse. And next one is called as rehabilitation. What is the meaning of here rehabilitation? Especially we are seeing this rehabilitation for the cancer patient, for the cardiac surgery patient. So what is the meaning of your rehabilitation? Once your treatment is getting completed, you must revert back for the previous position. In the sense, before the surgery or before the cancer, how is your living lifestyle? you must focus on revert back them for the normal situation. The duration of the time is called as rehabilitation. Here also you can be able to do. So these are the different kinds of the things we can observe as a scope of community health nursing. So this is a very important, this kind of the question will come for your theoretical exam. So my dear students, today I have discussed about what is the characteristics of the community health nursing, what is the scopes of community health nursing I have discussed. My dear students, I hope you understood this session. If you want to continue my classes, please subscribe and like and share. By that you will get my all the community classes that will be useful for your future. So thank you so much for you paying your attention. I will come with your another topic in the community health nursing. Until that, stay tuned. Thank you so much, my dear students.